Hello, and welcome to the Saúde da Próstata channel. If you're new here, this is your space to better understand how to take care of your prostate health with clear, trustworthy, and evidence-based information. We speak directly to you, someone who wants to age with quality of life, autonomy, and well-being. Today, we're going to talk about a very important topic, the prostate biopsy. This is a fundamental test used to confirm or rule out a diagnosis of prostate cancer. And what you may not know yet is that this procedure has improved significantly over the past few decades. In this video, you'll learn exactly how this biopsy is performed today, with advanced technology, much greater safety and precision, and far fewer risks for the patient. Let's start with why this test is so important. Prostate cancer is the most common solid cancer among men, excluding non-melanoma skin cancers. In countries like Australia, around 20,000 new cases are diagnosed every year. In the United States, that number is expected to reach nearly 300,000 new cases in 2025, and these numbers only reinforce the importance of early detection. In the past, many men only discovered they had prostate cancer when the disease was already advanced, when it was causing pain, difficulty urinating, bleeding, or even signs that it had already spread to other organs. At that stage, treatment became much more complex. Over time, the PSA test, prostate-specific antigen, was developed, allowing us to detect abnormalities even before symptoms appear. But PSA is not a perfect test. It can show elevated levels even when there's no cancer, and it may appear normal even when cancer is present. That's why when a man has an elevated PSA or an abnormal digital rectal exam, the next step is often a prostate biopsy. For many years, this biopsy was done blindly. The doctor would insert an ultrasound probe into the rectum and use a needle to collect tissue samples through the bowel wall, hoping to hit the right areas of the prostate. This procedure was performed while the patient was awake, typically in an outpatient setting. The problem with that approach was twofold. First, it lacked precision. The doctor couldn't be sure they were sampling the suspicious area. And second, the needle passed through the bowel, which naturally contains bacteria, so there was a considerable risk of infection. Although the official infection rate was around 1%, in clinical practice it could rise to 5 or even 7% of cases. Fortunately, the way we perform prostate biopsies today is much more advanced. It's safer and more accurate thanks to a technique called MRI-ultrasound fusion. Here's how it works. When there's a suspicion of prostate cancer, the next step is often a prostate MRI. This is a painless exam that takes about 30 to 40 minutes, uses no radiation, and produces highly detailed images of the prostate. It helps identify suspicious areas, their size, location, and whether a biopsy is truly necessary. In about 90% of cases, the MRI provides reliable information. Of course, no test is perfect. There is a small false negative rate, but in most situations it's an excellent tool for deciding the best next step. If the MRI reveals a suspicious area, the doctor may recommend a biopsy. And here's where the new technology comes into play. Instead of taking random samples, the doctor can now combine the MRI images with real-time ultrasound during the procedure. While the patient is under anesthesia, asleep and comfortable, an ultrasound probe is inserted into the rectum to capture live images of the prostate. These are then merged with the previously obtained MRI images. This fusion allows the doctor to see exactly where the suspicious area is and to guide the needle precisely to that location. This is known as image-guided fusion biopsy. Another major improvement is the path the needle takes. Unlike older methods, the needle no longer goes through the bowel. Instead, it is inserted through the skin between the scrotum and the anus, a region called the perineum. This technique is called a transperineal biopsy. This change drastically reduces the risk of infection because the needle no longer passes through areas with bacteria. The procedure is much safer and also much more precise, as the needle goes directly to the suspicious target seen on the fused images. The entire biopsy takes around 20 to 30 minutes. After the procedure, the patient stays under observation for a short time and can usually go home the same day. Recovery is quick, with only mild discomfort. In just a few days, the medical team contacts the patient to discuss the results. If the biopsy is negative, that's great news. If it's positive, the patient receives clear guidance on the next steps, always in a personalized way, respecting each individual's case and pace. This technological evolution represents much more than just a change in method. It represents greater safety, more comfort, and much more reliable diagnoses for thousands of men around the world. Early detection of prostate cancer is crucial to ensure more treatment options, a higher chance of cure, and better quality of life. If you've made it this far, and this information helped you in any way, please go ahead and give this video a thumbs up. That really helps the channel grow, and makes it easier for more people to access content like this. And if you haven't yet subscribed to the Saúde da Próstata channel, do it now. Every week we bring you new videos with tips, clear explanations, and the latest updates on everything related to prostate health and men's well-being. If you know someone who should watch this, whether a friend, family member, or co-worker, share this video with them. Sometimes information can make all the difference. And of course, if you have any questions, concerns, or if you'd like to share your own experience with tests, symptoms, or diagnosis, leave a comment down below. We read them all and respond with care and respect. See you in the next video. Take care of your health and take care of your prostate.